Hello, good morning. Thank you for joining us today for this important update on COVID-19. Joining me today is Dr. Leon Haley, the CEO of UF Health. In addition, I'd like to recognize several people in our audience, Council Vice President Sam Newby, Councilman Ron Salem, and Terrence Freeman. Thank you all for being here today. Thank you for all of your roles as we battle COVID-19. I also want to thank Dr. Charles Moreland, Director of Community Affairs, and Stephanie Birch, Deputy CAO, for all of their work over the last year in testing and now vaccinating people. According to the latest data from the Florida Department of Health, there are 75,178 cases of COVID-19 in Duval County, 816 deaths, and an overall cumulative positive testing percentage of 10.04%. Daily percent positive tests for Florida residents in Duval County are 8.54%. I continue to, and have since all of this started, speak regularly with our area hospital leaders, and while we are seeing a spike in cases, they report 496 current COVID-related hospitalizations in Duval County, which includes 114 ICU patients. You will be hearing more from Dr. Haley about this in just a moment, but we are experiencing an uptick as a community and the spread increases. Just a reminder of where we were and where we are now. When all this started in March, and even we were warned before, the country was largely in some form of a shutdown to protect our health systems based on models. Models that were new to all of us because this was a new event. And we worked our way through that. We were able to get back to some sense of normalcy, people going to work, wearing masks and being smart. But we always communicated with people, myself and our healthcare leaders, that until people are vaccinated, the virus is with us and we're going to have to figure out how to live responsibly, which means there's going to continue to be community spread risk, and it will likely happen based on behaviors. We saw that over the summer. We were still learning at that point in time, but our hospitals were able to handle the load over the summer. And we're experiencing it right now. And while they're handling it, it's important that people take this seriously. The mask is not a political statement. Every healthcare expert and hospital leader that I work with and talk to asks me and encourages me to keep the simple tool of masking when you're indoors and you can't practice social distancing in place. If you're someone that doesn't take this seriously, I mean, look, you can talk about risk factors and the likelihood that you end up in the hospital and the likelihood that it is deadly, but you hear these stories and you see these stories over and over again where people say, this can't and won't happen to me, and then tragedy comes to a family. So let's be smart and let's be responsible. As of this morning, the city of Jacksonville has been able to vaccinate more than 8,000 individuals at its 2 COVID-19 vaccine sites since opening to the public on January 11th. The city-sponsored locations have averaged 1,100 vaccines per day, and we stand ready to open more sites if is important, if the supplies are available. The Duval County Department of Health is responsible for the vaccine site at the Prime Osborne Center, and the State Department of Emergency Management intends to open an additional site at the Regency Mall in the near future. Again, that is the state of Florida. We'll be opening that site. We are fortunate to have a vaccine available so quickly. Many of you have expressed your frustration with the availability. Please understand that the city of Jacksonville does not control the supply chain and what's available. While the state of Florida determines who receives their weekly allotment and how much, they don't even know how much they will get on a week-to-week basis. At this time, we anticipate that the city will run out of its first dose of vaccines this Thursday by the end of the day. If you have received your first dose at either of our senior centers, that's the city centers, you will receive your second dose at the same location you received the first, 21 days or after your first injection. But to be clear, at this moment in time, those getting the original vaccination without additional supplies, we run out on Thursday, and at the end of day Thursday, we can no longer operate those centers for new vaccinations. We've made our state and federal partners aware that we have the capacity and the infrastructure in place to continue offering the vaccine and even expand locations. We've been extremely successful getting these vaccines to our most vulnerable individuals, and we stand ready to bring new sites online if needed. Our team has demonstrated time and time again throughout this pandemic we can provide testing, vaccines, CARES Act funding to the people of Duval County in an organized, timely, and safe manner. Our state and federal partners are aware of our interests and ability to continue to provide vaccines to our community, and we have full confidence in the very complex logistical processes our federal and state leaders are undertaking. It's important that we stand together as a community, as a state, and as a country to work together to get these supplies out to people. While our most vulnerable population now has access to the vaccine, it's extremely important we do not become complacent and that everyone continues to do their part. Thank you for continuing to wear masks, social distancing, washing your hands, and stepping up your sanitation practices. We must keep it up and maintain the course. We cannot be careless. As long as the virus is with us, the possibility of community spread remains. So we must reduce the opportunity the virus has to spread and starve it out. We can do this, and we must do this. To go into a little more detail on availability of vaccines, the governor and the State Department of Emergency Management are notified every 7 days how many vaccines Florida will receive the following week, and this number has varied each time. For example, last week, the entire state received 275,000 units of the vaccine. I hope this helps clarify why this is a very fluid situation. Obviously, at this pace, it could take months before most of us receive the vaccine. However, when it's your time, I strongly encourage you to take it. Right now, as ordered by Governor DeSantis, we are vaccinating those 65 and older, healthcare workers, and first responders. That's why, as I said, wear your mask, maintain social distancing, avoid large crowds, and frequently sanitize your hands and other surfaces. These simple steps remain our greatest tools in combating this virus right now. Now I'd like to bring up Dr. Haley, the CEO of UF Health Jacksonville, to talk more about what hospitals and our community are currently experiencing.
Thank you, Mayor Curry. Appreciate the opportunity to come and talk with you today. Councilman Freeman, Newby, and Salem, we also appreciate you being in attendance today. I'm going to reemphasize one of the things that Mayor said, and I will keep reemphasizing as I talk through where the hospitals are today. I want you to continue to wear your mask, even for those of us who have been vaccinated, because until we can get to a point where a number of our citizens here in this community and beyond have been vaccinated, it is still critically important for you to wear your mask, socially distance, and of course, to continue to wash your hands and practice good sanitation practices. Let's go back just about a year ago to March 11th, right? The day the world seemed to stop. At that point in time, COVID was spreading dramatically. The NBA shut down, the NHL shut down, and hospitals were scrambling across this country to be able to find enough PPE and be protected well enough to take care of not only their patients in this newest disease, but as well as their employees. In the early phases, hospitals, fortunately in this city, the hospitals here in town, myself and the other CEOs have the opportunity, even prior to COVID, where we would meet on a regular basis to talk through those common issues, whether it's disaster preparedness, hurricane preparedness, and we were able to very quickly pivot into talking and discussing around COVID pre-treatment, COVID precautions, maintaining PPE. And so we've been able to have that relationship, including to a point where we're meeting almost daily to talk through all those issues. Fortunately, the mayor was able to join us along with his staff, and we were able to share our questions and concerns and comments with him. And we've been able to do that almost for an entire year. Early on in COVID, again, a focus on PPE, treatment, learning what was happening in New York City, and obviously hospitals struggling to maintain that volume. Over the course of the early part of the summer, thinking that we had gotten past COVID, the numbers started to spike. And so early in July, the city numbers as a whole went over 500 total hospitalizations. At UF Health, we received 111 patients that were in our two hospitals between our downtown and north campus. But thanks to social distancing, masking, and proper procedures, We were able to get those numbers down into the low 30s in September. Unfortunately, the second surge that all of us have been dreading is here, and we are still in the middle of that, although there is some encouraging signs. As of today, there are now 510 patients in between all of the hospitals in the city of Duval and city of Jacksonville. 68 of those are patients that are COVID positive and on a ventilator, 120 total patients in the ICU. One of the big things that we've learned with treating our COVID patients over the last 6 to 8 months has really been how to use oxygen judiciously, right? Early on, everybody got intubated because we saw patients with their oxygen levels being low, and then we've learned that some people can tolerate that more so than others. So we've been able to use our ICU ventilator capacity much more judiciously than we were in the past. Just to give you an idea, in all of the hospitals, there are 188 total intubated patients, but there are over 330 ventilators that are now available across the entire city. The 510 number that is today is down from 536 yesterday. It's down from over 600 over the course of the past week. So the good news is we are starting to see a little bit of a turn in how hospitals and the hospitalizations that are occurring across the city. The mayor mentioned that the positivity rate in the city of Jacksonville is now an 8.4%. That's good because just as recently as 2 weeks ago it was 15%. Typically what we see is that as that positivity number goes up, it takes about 2 to 3 weeks to see a hospitalization number, and then unfortunately the deaths are to follow about a week or so later. So as we begin to see that positivity number go down, we will see the hospitalization number go down, we will see the death number go down, and those are important facts for us as we continue to work through our treatment protocols. But let's be clear, we still at UF Health Jacksonville have 115 active patients in our hospital right now that are COVID positive. 25 of those are in an ICU, 10 of those are on ventilators. That number is still higher than any of our numbers over the summer. So much like all the other institutions, although those numbers are starting to come down, we are still very busy as a hospital practice. But we've learned over the course of that 6 months, and so we've continued to do our elective surgeries, we continue to do elective procedures, and fortunately right now we have a boatload of PPE. In fact, we were able to convert the old dental school that's on our campus into a PPE storage facility. So we have better control of our PPE, we have better control of our treatment parameters, we have better control of how we treat ICUs. I'll just leave you with also, as the mayor talked about, thanks to Governor DeSantis, federal government, and Pfizer, we were able to start vaccinating our hospital employees on December 14th. And since that time, since December 14th, we've now vaccinated over 11,000 people, primarily hospital workers, but also a significant number of senior citizens in our community who are primarily UF Health patients. Our colleagues in Gainesville have vaccinated over 17,000 patients. So collectively, as an organization, we're close to 35,000 vaccinations over the course of over the last 6 months. Over the last month. So it's important for us to continue that vaccination process. We are also waiting for our next dose of Pfizer so that we can begin another round of giving people that first dose. I've received 2 doses. I've been just fine. And so I will encourage you to continue to wear your mask, continue to distance, continue to wash your hand, and when available, please make sure you get the vaccine. Beyond a sore arm, I had no complications. Yes, we had a few people with a sore arm and some myalgias, but it is part of the toolbox that we will need as a community to continue to fight COVID. So wear your mask, social distance, wash your hands, get the vaccine when it's available, and we will continue to need to do that for the next several months until enough of us have been appropriately vaccinated. Thank you for this opportunity, and be happy to answer questions along with the mayor.
Council Vice President, if you guys would like to join us in the event there's any questions for council. Anybody got any questions?
I do. Can you hear me? All right. Is there an estimated time when the state will be providing more vaccines to the city after the vaccines run out?
There is not. Right now, the state has a plan to open their own site at Prime Osborne Center. So where we stand right now as a city is if things go as they are at this moment, at the close of business Thursday, we will not be able to vaccinate new people at those sites. That doesn't mean vaccines and vaccinations won't be available in our city. They will just be controlled by the state of Florida at that moment in time. But as I even said, they don't even know a long-term view of what supply they'll have.
Mayor, have you been in contact with the state about the Regency site and when that could be, when vaccines could be given there along with testing? We've heard it could maybe open up as soon as tomorrow. What are you hearing there? And also, are you concerned too with the senior sites no longer being able to offer the vaccine? There's going to be a lot of discouraged people out there. That seemed to have been a very successful program by doing it on the date of birth. And, you know, there have been lots of people that have taken advantage of that. Are you concerned about what message this is going to send?
I don't have a definitive date on when they will open Prime Osborne, but I know they're committed to it and they're going to get it done. I am in regular communication with the administration in Tallahassee, and look, they're committed to getting the vaccine to people. Of course, locally, we would like best case scenario, perfect world, which we don't live in. We don't live in a perfect world. We would love to have control of pulling in supplies and be able to distribute at our centers. Because we've demonstrated we can do that effectively, responsibly, and in a safe way, and an efficient way. But that's just not where we are right now with supplies. And so what I would encourage people to do is where the vaccine is available, whether it's distributed by your city or your state officials or federal partners at some point, get the vaccine there when it's your turn, and understand that we are facing a national logistics issue. An unprecedented situation we've never been in, both from dealing with COVID-19 to now having to vaccinate people and to get those supplies into every state, every city, and every county. So I don't want to say be patient because people are anxious, but I do want to say officials, your state officials, in conjunction with your local officials, are going to do everything we can to partner and make sure that when it's people's turn to get the vaccine, we get it to them, and we just got to keep fighting for supplies.
Mayor, first, thank you for taking our questions. If the city were allotted more vaccines, do you have the capacity to open up more sites than Lane Wiley and Mandarin? And we've also heard concerns about even the Beaches community not having enough access to these vaccines.
I'm sorry, was the last part?
The Beaches community not having access.
Yeah, yes, we have capacity. If I had truckloads, properly refrigerated, right, doctor? If I had truckloads of the vaccine in our county and our city, if I had unlimited supply, we have the manpower, personnel, and space to get this done, as we demonstrated when we were testing people when we started up at beginning of 2020. But again, I don't think that it's helpful at this point to point fingers, to say who should be doing what. The reality is we're trying to get a vaccine distributed to states all over this country, to cities and counties, and we're all just going to have to find a way to work together. If we get access to large amounts of supply, we'll expand. Right now, opening a place at the Beaches, we don't have the supplies to go there. If we did, we would.
Mayor, does it look like then that these sites, the city-run sites, are simply going to go away and they're not going to operate again in the future? Can you keep turning the faucet on and off? Or what exactly is a long-term outlook for the city having its own city-run sites for these vaccines?
Sure, if we have to turn it off, it's important for people to know that if they've received their first shot and we can no longer operate as of the end of the day Thursday, you're still going to, we have the supplies for your second shot. That's accounted for. But if we have to turn the faucet off, as you stated it, Dave, we will be prepared to turn it back on if we get access to supplies. It's a fluid situation, and we're all just going to have to adapt, which is what we've done as a community since March of last year.
This is for Dr. Haley. Can you tell us what's happening with vaccines at UF Health? Are patients being given them, and has all of the staff received it? What's the situation there?
Yeah, that's a great question. So much like the city, we have the same supply chain challenges with the state, or numbers from the state, but just in how we get that on a regular basis. So originally we were given just short of 20,000 doses, around 19,400 on December 14th, with the directive from the state to vaccinate our frontline healthcare workers, those directly involved in patient care, and we started that process. The governor then changed and added implemented an executive order to add patients who are citizens that were older than 65. So since December 14th, we have been simultaneously vaccinating healthcare workers with their first dose, and we've already started on our second dose for the healthcare workers. We have vaccinated seniors that are associated with UF Health. So these are seniors that are basically our patients. We've been able to do that at our downtown campus, our north campus, and just recently we opened up 2 of our satellite clinics up at Wildlight, which is in Nassau County, and at Dunn Avenue. And so between those 4 sites, and we usually do them on a rotating basis, we've been vaccinating, again, sort of healthcare workers and seniors over 65. We would obviously like to extend that, but we have to wait until we get additional supply. We've only been given the first round of Pfizer and the second round of Pfizer. We have not been provided with any Moderna at this point in time, so we've asked for that, and so hopefully we will be able to receive that shortly. And then we have not gotten a second round of Pfizer. We too will be out of vaccine probably this week if we don't get a second round. Everybody who's gotten their first dose will get the second dose, but for sort of that starting with the next first dose for the next group of citizens, we won't be able to do that until we can get additional supply.
When you say the patients that see the doctors at UF Health, so that's anybody that's been there, or how does that work, or who decides?
So we've got, I can't remember the exact number, but we have about 40,000 patients in our database that are over 65. We've actually been reaching out to them directly. So we have an app called My UF Health where we reach out and say, if you would like the vaccine, we'd be happy to help you get you scheduled. And some people have to call, some people can do it off the app. So that's been our starting point. We've also tried to work with some of our staff members and some of their family members who are also patients of ours as well.
Dr. Haley, this is also for you. Can you explain the role that UF Health and any hospitals in the area might play with distribution at some of the state or city-run sites? Can you explain how that works in the back end?
Sure. So from the state's perspective, originally the state made a decision that they would receive 100,000 doses of Pfizer. They took the approach of selecting 5 hospitals across the state: UF Health here in Jacksonville, Advent Health in Orlando, Tampa General in Tampa, Jackson Memorial in Miami, and Memorial in Fort Lauderdale. Each of those hospitals were given basically an equal proportion. That was the 19.5 that I was asked to provide. And then the directive was vaccinate healthcare workers and share those doses with the other hospitals in the city until they can get their own subsequent doses. So we shared with every hospital in the city of Jacksonville. We also shared with our colleagues in Gainesville. All of them then subsequently got some doses of the Moderna, depending upon what they had put in terms of their number of healthcare workers, which is what they receive. We will provide them and have provided them with their second dose of the original Pfizer. They have also probably taken the approach of vaccinating their healthcare workers as well as distributing it to their patients and standing up where possible any other community sites that they can. But all of us will be challenged with getting that next dose to continue to supply.
Sydney Bowles, WJCT. 2 questions. What ACA accommodations are being made at vaccine sites for people with disabilities? And relatedly, are there plans to administer vaccine shots to people in cars for folks who might have trouble standing for long periods of time?
So we're still working, obviously on our sites we can take care of any patient with any disability in those unique locations. We have chosen at this point not to do patients in cars as of yet. We have been very strict about following the CDC guideline on the 15-minute monitoring period. We feel very comfortable with our current process. People can certainly drive up. We can help get them in, and we've been able to do that. Just this past Saturday, we vaccinated 1,100 seniors, including several of whom that are in their 80s and 90s, and we can make the appropriate accommodations. We generally have at least 1 or 2 physicians on site so we can monitor for any allergic reactions. So we have taken the approach that they can certainly drive up. We've made it easy for them. We have golf carts to come pick them up and make sure we can get people to where they need to be. But we've been very strict about monitoring them in our facility, make sure we can keep an eye on them. So we haven't taken the approach to do cars. I think once we can get more vaccine, and obviously as some of the other vaccines may not have the same monitoring period, then I think we can expand the way that we approach it. But we've taken the approach that everything is on site at this stage.
Dr. Haley, do you know if anyone within UF Health has been detected with that variant strain detected over in the UK originally here in Jacksonville?
Not that we're aware of. We do know that the strain is here in the state of Florida, really across the country. So we would expect that some of the people that are positive in our system probably have that strain, but we have not specifically tested for it. Yes, you can go back and do genetic mapping with it, but that's not a capability we have on campus. We'd actually have to send that to a state lab, and they would do that. So that's how they're able to know that that variant is here in the state. But most people are still approaching it. It's still COVID. We still have to take care of it in our conventional means as we know it. You need to worry from the perspective of all the indications that we've gotten so far from the strain in Britain, Brazil, and South Africa is that they spread more easily. They seem to be less virulent, and so in other words, their ability to cause disease and significant morbidity and mortality seems to be less, but it does spread faster, which is why we will always emphasize, at least until we can have a significant number of our citizens vaccinated, you must wear your mask, you must do your distance, you must wash your hands. Those are still critically important since it does spread easier.